back at some stage. Okay, sorry, Mel's just started the recording. Okay. It's often diagnosed late, and it's diagnosed late, and around 25% of all cases are diagnosed at a late stage, particularly in women. And Phil will talk about that a little bit further on in the presentation, why the symptoms might be mistaken for other things, which is why a lot of women, unfortunately, end up in an emergency situation in hospital because of their symptoms. It's bladder cancer, but it's been mistaken for another illness or disease, and it hasn't been diagnosed and treated. Okay, so the next slide, just a few statistics about Northern Ireland, well, the whole of the UK. I know that statistics don't mean an awful lot if you're not working in this field, but just to put it into context, every week in Northern Ireland, about 10 people will be told that they have bladder cancer. So that's quite a stark figure. And that sort of brings it home why it's not a rare cancer and why it's so important to be aware of the signs and symptoms so you can act upon them and get treated earlier and have a better outcome. Okay, and the next slide now is where I hand over to Phil, who can introduce himself. Phil has got a bladder cancer diagnosis, had a bladder cancer diagnosis, so he's going to be talking from his own experience, but his huge knowledge of the field as well.
I've unmuted, but I still have no sound. I thought the mute was for me.
Okay. That's great.
Right, I'll start. My name's Phil Kelly. I'm a bladder cancer patient, and I am also a patient advisor with Action Bladder Cancer UK. So I'm a patient, not a clinician. So what I'm going to tell you about the urinary system and bladder cancer is going to be relatively easy to understand and straightforward, hopefully. So just as a sort of basic introduction, the urinary system consists of the two kidneys that send the waste from the body down the two tubes called ureters into the bladder, which has got a muscle wall that relaxes as urine goes into the bladder and contracts when it's full, so that it then squeezes the urine out through the urethra. So that's sort of the urinary system. On the next slide, what is bladder cancer? So bladder cancer, like most cancers, is a growth of abnormal tissues. And in the case of bladder cancer, it develops usually first on the inner lining of the bladder. So on the diagram, you'll see the top right-hand bracket is non-muscle invasive bladder cancer. And what you see there are growths that develop on the surface or start to develop and grow into the layer of the bladder that is before the muscle layer. So that's non-muscle invasive bladder cancer. On the left-hand side of the diagram, we've got the different stages of what is termed muscle invasive bladder cancer for fairly obvious reasons. As you can see, it's growing into or through the muscle layer itself. So the top left-hand side, it's starting to grow into the muscle layer, and the bottom left-hand side example, it's grown through the actual bladder wall and is in contact with other organs. The problem with muscle invasive bladder cancer is that it's become in contact with the blood system to the bladder, which gives it the potential to be transmitted to other organs within the body and is far more life-threatening than non-muscle invasive bladder cancer. As a point of reassurance, probably 75–80% of all bladder cancers are non-muscle invasive bladder cancers. Within the non-muscle invasive bladder cancer, there are 3 basic different risk groups that reflect the degree of aggressiveness of the tumour and also the number of tumours and where they are. So on the top right-hand side, we can see a growth that is flat and on the surface of the bladder lining, which is actually called carcinoma in situ, which is an aggressive and difficult treat form of non-muscle invasive bladder cancer. The one above it is just growing into the lining of the bladder, isn't too big yet, and that could easily be less aggressive and potentially more readily available for treatment. And then the third one, the top one in that non-muscle invasive bladder cancer bracket, has obviously become a bigger growth and is further into the lining of the bladder and is probably towards the top end, the high risk end of non-muscle invasive bladder cancer. All of the muscle invasive bladder cancers are life-threatening and tend all to be aggressive forms. Next slide, please. Before I go on to talk about symptoms of bladder cancer, we thought we'd just test your knowledge to see what your understanding is of the potential symptoms of bladder cancer. So we'll give you a minute to complete this poll, and you can tick as many as you think are the symptoms of bladder cancer. Okay, so a quick result from the poll, and 98% of people have put blood in your wee, which is very good. Feeling the need to pass urine is 90%, 72% urinary tract infections that keep coming back. I think you've been doing your homework, and maybe you've been looking at the symptom sheets that we've shared with your organisation previously, because that will obviously prove to be the most typical symptoms of bladder cancer. It's not one where there's an obvious lump. It isn't one where there's obvious significant weight loss. And it doesn't usually precipitate serious levels of fatigue or changes in bowel habits. So moving on to look at symptoms. The next slide, please. So the most common symptoms of bladder cancer, as the poll has indicated, are, next, blood in the urine. And that can be just one incidence of blood in the urine. It varies as to how obvious it is, from bright red through to different shades of pink and brown. And sometimes the blood is actually in microscopic form in the blood, so it's not even obvious to the human eye. Next point. Recurrent urinary infections, as many of you already have said, probably recurrent and unexplained recurrence of urinary infections, UTIs as they're referred to, are a typical indicator that bladder cancer could be an issue. And the other most common symptom is frequency or urgency of passing urine, pain when passing urine, especially when the tests for urinary tract infection have been negative, so there isn't an obvious explanation for them. It's not a set of symptoms that are like other cancers where there's a lot of pain and fatigue. So it isn't necessarily that obvious to people, which is part of the reason why it tends to be diagnosed quite late. Next slide. So how did I find out about bladder cancer? I was diagnosed with bladder cancer 11 years ago, so in 2010, and my experience was just one very bloody wee, which scared me to death. It wasn't something that I could not be aware of, but typical of probably a man of a certain age, I was thinking that maybe I would wait to see if it happened again before I did anything about it. Fortunately, my wife wasn't of that disposition and dispatched me quickly to the GP, who did all of the right things in the right orders. So she gave me some initial tests, and when they didn't indicate that there was a urinary tract infection or anything else obvious, she referred me quickly to hospital where a diagnosis of bladder cancer was confirmed through hospital investigations that we'll be talking about. I was diagnosed with the non-muscle invasive bladder cancer form of bladder cancer, but mine was one of the higher risk versions of non-muscle invasive bladder cancer. I started what is, and well, was, and probably still is, the most common form of treatment for that version of bladder cancer, which is BCG vaccine into the bladder. Unfortunately, as it turned out, I was one of the 25% of people for whom BCG is not effective. I developed a strong reaction to it. Treatment had to stop. There weren't any other alternative treatments available to me at the time. So 15, 16 months after my initial diagnosis, I had my bladder removed and I have a urinary stoma and urine bag. So that was my experience. On reflection, I probably was a little bit more tired than usual. I probably did have a little bit of lower back pain around the kidney areas, but that was as far as it went. Just one incidence of blood in my urine was the start of my journey. Next slide, please. As I suggested, Action Bladder Cancer UK have developed a relatively easy to understand, simple bladder cancer symptoms guide that we've previously made available to your organisation. If you haven't seen it, if you haven't got a copy of it, do get hold of one. We'll make sure that it's available to you. Put it on the back of your bathroom door. Share it with friends and family, because unlike yourselves this morning, most people aren't aware of bladder cancer. I hadn't any knowledge of bladder cancer before my diagnosis. I didn't know anybody who'd had bladder cancer. So it's generally not well known about, and the symptoms aren't very obvious and can be ignored. As Jackie indicated early on, it's a particular problem for women in that if the main symptom of bladder cancer is relating to blood in your urine, you can imagine that gynecological and menstrual explanations for that kind of issue can be sometimes mistaken. There is a tendency for GPs to take longer to explore other potential explanations before they refer to hospital, which leads to a later diagnosis generally for women and worse outcomes. So do make the symptoms guide available to anyone in your family and your friendship groups. Put it on the back of toilets at work, whatever you can do really to make sure that people are aware of the symptoms. Moving on, next slide, please. So what are the factors that increase your risk of contracting bladder cancer? Like with most cancers, smoking, including passive smoking, is a common factor in bladder cancer, as it is with all cancers. I smoked for a period of time as a young adult, but looking back, I was brought up in the days when most people smoked, and in the work environment, in the social environment, you were inhaling cigarette smoke all of the time. Next point, please. Chemicals at work. Bladder cancer was previously associated with the dye and rubber and chemical industries. Not surprisingly, people were working with toxic substances that were absorbed into their bodies and developed cancer. Things have moved on. Health and safety regulations and just better practice at work has reduced that as a factor, but what we're discovering is that more recent research suggests that there are new toxic substances that are having an impact on levels of bladder cancer. This could include organophosphates and other agricultural chemicals, hair dyes. There's a high incidence of bladder cancer that's been detected in firefighters in America, which, if you think about it, they're in environments where there are toxic elements that are superheated. So chemicals at work. They can also be chemicals that are ingested in other ways. There's increasing evidence to suggest that there is a link with some of the recreational substances that are being taken in perhaps the younger population. Next point, please. Recurrent or long-lasting bladder infections are themselves a risk for bladder cancer. If you think about it, it means that the inside of your bladder has become inflamed, infected, and that presents a greater risk of contracting bladder cancer. So it's a symptom of bladder cancer, but it can also be a precipitating factor as well. Next point, please. However, in over 50% of bladder cancer cases, the cause is unknown. We haven't got all the answers as to what might lead to bladder cancer, but we've got some of the main suggestions of what could increase your risks. Next slide, please. Screening for bladder cancer, next. There isn't one, which is a big problem. There isn't a national screening for bladder cancer, unlike bowel cancer, lung cancer, and some of the other cancers. There isn't a definitive test for bladder cancer that can be easily shared within the general population in a preventative sense. That said, we're probably on the threshold of being able to use a urine type test that gives a strong indication of bladder cancer, but it's in the clinical trial stage as we speak, and it's going to be some years before it's proved to be effective enough to be accepted as a national screening test. So that makes it all the more important that people should be aware of symptoms, because there isn't another easy way of filtering out people who have got early stages of bladder cancer. Like with most cancers, the earlier it can be detected and treated, the better the outcome. So we're hoping that some of the research that's being undertaken will lead to a practicable test that can be used. Next point, please. So how do you test for bladder cancer currently? Urine tests at primary care are a typical first step. So our simple urine dip test would be undertaken, which is to eliminate the possibility of urinary tract infection as an explanation. Next point, please. Possibly blood tests, and it would also be association with the symptoms that we've described, which would lead to a referral to hospital, which is where most of the investigations for bladder cancer would take place. A flexible cystoscopy is a camera examination of the inside of the bladder itself, which is probably the most effective way of detecting certainly a concerning growth in the bladder. So a long tube with a light and camera at the end is inserted through the urethra, so through the private parts and into your bladder. And as a patient, you have the rare privilege of usually being able to see exactly what the clinician can see, because it's on a screen that you usually are able to have a look at. It's an interesting experience to see a growth on the inside of your bladder as a patient lying on the table. So that's a very obvious way of finding growths inside the bladder. Next point, please. If a growth has been found in your bladder, then the next stage would be trying to ascertain whether it's actually cancerous, whether it's benign. And some of the methods that are used for that purpose are scans. And as part of the initial investigation of bladder cancer, it's common for people to have an ultrasound scan. So the kind of scan that is used in pregnancy, which is a simple scan with gel on the abdomen that looks at the sort of inside of your abdomen. It can also be a CT scan, or in some places an MRI scan, which confirms what kind of a growth it might be. Next point, please. But the more definitive diagnosis of bladder cancer is usually or often dependent on what is called a TURBT, which is a transurethral resection of the bladder tumor, which is a fairly minor surgery, which again is undertaken with a tube with instruments at the end that is inserted again through your urethra, this time under general anesthetic, which has a light at the end, an ability to see growths within the bladder and also to remove them. And the growths would then be sent for histology. Path labs would have a look at the growth, and it's only when the histology has been completed that a confirmed diagnosis of bladder cancer can be made. When I say that it's part of the investigation for bladder cancer, it's also the first treatment for bladder cancer, because they will attempt to remove any growths within the bladder. So tumours would be removed. So that is obviously part of the treatment for bladder cancer itself. Next slide, please. So treatments for bladder cancer. Well, it depends on the type, the stage and the grade of the cancer. So the type of bladder cancer would be, as I referred to in that early diagram, non-muscle invasive bladder cancer or muscle invasive bladder cancer. The stage is to what degree the growth has penetrated into, or potentially in some cases through, the inside layer and into the muscle layers of the bladder wall. And the grade of the cancer is a measure of how aggressive the bladder cancer is. So that's on a scale of 1 to 3, with 3 being the most aggressive. So the actual treatment obviously depends on how far it's grown into the muscle, what level of aggressiveness it has, and how big and how penetrating it's become. For some of the lower risk non-muscle invasive bladder cancers, following the TURBT procedure, which has removed the actual growth, then it may be that the only ongoing treatment for that form of low risk non-muscle invasive bladder cancer is active surveillance. Active surveillance is ongoing monitoring. And in the case of bladder cancer, that's usually for a number of years. And it can be almost for a lifetime, but certainly it can be 5-10 years of active monitoring. And the monitoring for bladder cancer is mainly by way of further examinations into the inside of your bladder. So again, the cystoscopy, where the camera is inserted and is able to examine the inside of the bladder. It can include CT scans or other scans. And that process would be going on because, as Jackie indicated early on, bladder cancer has got a real habit of recurring. It's probably the most highly recurring cancer. So it's a persistent form of cancer that keeps trying to recur. Next point, please. If your cancer is of the type that is non-muscle invasive, but isn't the low risk, it's more life-threatening than the low-risk form of non-muscle invasive bladder cancer. So it might be more aggressive, there might be more growths, they may have gone a bit further into the lining of the bladder itself. Then the usual or the standard treatment would be installations of a chemotherapy drug which is called mitomycin C or TB vaccine. Installations meaning that a catheter is used to actually insert these substances into the inside of the bladder, where the patient retains them for a period of time. They do whatever it is that they're going to do, and then they're excreted out in the urine in the usual way. BCG treatment, TB vaccine as it is, has been an established treatment for non-muscle invasive bladder cancer that is high risk, and that has been in use for several decades. Mitomycin C is a chemotherapy drug that is used with other cancers, but the unusual feature for bladder cancer is that the treatment isn't put into the bloodstream, it's actually put into the bladder. The difficulty with TB vaccine is that it is, well, it's a toxic substance, and the reaction to BCG does tend to increase over time. In my case, the response to BCG was very strong and very quick, but most people will react to it at some stage. Classically, these types of treatment can go on for an extended period. It's not a one-off situation. So a course of these two substances will be put into the bladder once a week for 6 weeks, and then there'd be a resting period where checks would be made to see if they're being effective, and quite often and commonly for the more high-risk versions, further courses of treatment would be completed over a period of up to 3 years. So this is an ongoing form of treatment for non-muscle invasive bladder cancer. Next point. Chemotherapy and increasingly now immunotherapy are the sort of classical approaches that you would be more accustomed to with other cancers. So we're talking probably here about muscle invasive bladder cancer. So the more life-threatening forms of bladder cancer where the cancer has been in contact with the blood supply to the bladder muscle wall, where there's a risk that the cancer could have spread or could spread to other organs within the body. So this chemotherapy, unlike the mitomycin, is given into the bloodstream, so on a drip in the usual kind of a way. Immunotherapy drugs are becoming available for bladder cancer, but usually for at least muscle invasive and more often the more advanced forms of it. So these are new drugs that have been trialed with other cancers that work upon the immune system. Radiotherapy is less commonly used with bladder cancer than with some other forms of cancer. It can be used where there is a discrete tumour that perhaps could be reduced. In the case of muscle invasive bladder cancer, a combination of chemotherapy and radiotherapy is common these days to try and both address the tumours and the radiotherapy to address perhaps growths that might be appearing in the lymph nodes or in other parts of the body. Next point, please. Bladder removal is or has been a fairly standard approach to muscle invasive bladder cancer. and usually it has been in combination with chemotherapy that has been given before and sometimes after removal of the bladder. So bladder removal is literally, as it says, removing the bladder, but also in men, the prostate gland and various other bits. In women, it usually or often includes what is known as a hysterectomy type surgery, so removal of other organs are associated with the bladder. It's not just the bladder. So it's a very significant surgery and has been quite commonly used for muscle invasive bladder cancer. Fortunately, some of the new approaches of combined chemotherapy and radiotherapy, and sometimes also immunodrug therapy, are enabling people to avoid having their bladder removed. Next slide, please. And this is where I hand you back to Jackie to complete the rest of the presentation.
Unmute, okay. I was just waiting for some background noise to disappear, so sorry about the delay. Just a few slides about the work of Action Bladder Cancer UK. You've obviously heard from Phil all about bladder cancer. It's quite a complicated cancer. A lot of people don't know a great deal about it. They go and see their doctor about it, and the doctor sounds equally hesitant about it. A lot of GPs still need to be educated about all the signs and symptoms. So just a bit about our work. The main thrust of our work is first and foremost to raise awareness of this type of cancer, and that is with the sole aim of improving outcomes for patients. Okay, so as Phil mentioned earlier, we've got a symptoms awareness sheet. So if people can take those and put them in their GP surgery toilets or what have you, everything helps. We're here to also support patients through their journey. And we get calls to our information line from people that are concerned they might have bladder cancer. They're not sure about their size, their symptoms, what their GP has said. So people may not have actually received a diagnosis yet. And we also get calls from people that have received a diagnosis, feeling quite scared, anxious, worried, a bit confused about what they've been told, or people that are not very happy about what they've been told. They think perhaps they should be seen by another doctor who might know a little bit more about their type or stage or grade of bladder cancer. So we're here to support people at whatever stage they're at, from pre-diagnosis right through to end of life, if that's the case. We're also here to fund and support research. Bladder cancer has really lagged behind other cancers in terms of progress and development. And that one of the main reasons for that is because research into this type of bladder cancer sadly really lags behind a lot of the other more common cancers like breast cancer, prostate cancer, cervical cancer. So we're obviously here to do what we can about that. We do have a small grants program ourselves where we'll actually give grants out to support people who want to do something in the research world of bladder cancer, not just about drugs and treatments, but anything that improves the life of a bladder cancer patient. So it may be that a nurse who wants to run her clinic or his clinic in a different way to make it easier for bladder cancer patients. It may be that somebody wants to improve communication with their patients after they've received their diagnosis and are looking at ways of improving communication so people get answers to their questions more quickly, so they get reassured and less anxious about their diagnosis. So supporting any type of research into the field of bladder cancer is something that we as an organisation actively encourage. Next slide, Mel, please. And how we support those with bladder cancer, if you want to just add the next few points. We take inquiries from patients, family members, and we do that by phone, email, or social media, Twitter, Facebook. We've got patient advisors, like Phil happens to be one of them, and other patients with a range of bladder cancer experience. Some people will have had their bladder removed, other people have undergone different types of treatments. So we've got patient advisors who are able to talk to people that get in touch with us about their experience and give them some suggestions about, you know, any concerns they've got. And we try to connect patients with local support groups as well in their area. Whenever people ask us about this, we know that support groups aren't for everybody, but for some people, they are a lifeline. So if people do want to get together to share their experiences, support each other, we're very keen to try and start the process to get groups going and actually support them as whichever way we can. And next slide, Mel, please. And like I've just said, we're here to help set up and support patient support groups. All the information that we produce is on our website. Difficult for people of a certain age who might not be on the internet, but as well as having a website which has got everything, all the information that we produce and updates on latest developments and what have you, all of our information can be downloaded, printed off and sent out to people. So we're always happy to do that for people that can't get access to the internet. And we've got everything on the website, information about bladder cancer, treatments, patient stories as well. So if people want to look and actually read other patients' accounts of their experience, and that's usually quite useful and helpful as well. And next slide, please, Mel. And our patient information materials we have on the whole range of anything to do with bladder cancer. So bladder cancer itself, treatments, how to live well with bladder cancer. And we try to develop our range of materials all the time, working with patients who've got or had bladder cancer, and everything needs to be approved as well before it gets sent out. Okay, and like I've said, all can be downloaded from our website, ordered online in hard copy, or requested by phone, and we send these out by post. Very keen to get these out to GPs, surgeries, nurses, hospital departments, so they're there for people to pick up on the way out. And I think the next slide is possibly the last slide, which is our contact details. Please do get in touch with us if you've got any concerns yourselves, or you know of somebody who's got concerns that wants to either have a chat with somebody or just get some more information about what they should do about their situation. And you can get in touch with us by phone. Our phone number's on there, our email address and social media as well. Okay. And I think at this point, we're going to stop recording. Okay.